Hello, my fellow classmates. It is me, DeSanta, as you guys may know. This is my mom. You guys seen her in my previous This Is Me video. And now she's here again to help us talk about HIV and AIDS. So, Mom, if you can explain to us what exactly HIV is and, of course, what AIDS is. Because I know there is a difference between the two.
Yes, there is a difference. HIV is basically an human immunodeficiency. It's an infection, it's a syndrome, which you get through blood to blood contact. People that are in high risk behavior, such as men that have sex with men unprotected, women that have sex with men unprotected, women that have sex with high risk behaviors like injection drug use, any type of skin to skin contact, as far as open wounds, open cuts, blood secretions, as far as the semen, the HIV virus, because it is HIV is a virus, like an infection, and you get flu-like symptoms. A person can have HIV for a long period of time, as long as they're healthy and take care of themselves. Not everybody looks like they have HIV, so it's not like a homeless person. You have to look all shriveled up, like you're on crack or something, to say that, oh, that person has HIV. That's not the case. But if you're engaging in risky behavior, injection drug using, and sharing of needles without bleaching and cleaning the needles, if you're having sex with men unprotected, if you're a woman and you're having sex with guys unprotected, because you got to realize that if you're sleeping with someone and they slept with 10, 20 other people,
You pretty
just
much slept with all those
all
people
those
that
people
they
too,
slept with.
and vice versa. HIV virus has to have a port of entry, so that could be vaginal, that could be anal, and it could be oral. It could be as simple as going into your eye, mucous membrane, any type of cut, open sores in your mouth, your tongue, your cheeks, any type of broken teeth inside, anywhere, fingertip, hangnail, any type of port of entry of HIV contaminated blood can enter the body that way.
So it's not just sex, you guys. You can get HIV any type of way. It's not just unprotected sex. You can get it a lot of ways. So, Mom, all the information that you just spilled out, you have any experience in that field? Because I know you used to work at the health department.
Yeah, I worked at the Long Beach Department of Health and Human Services HIV STD testing program for 7 years, and I started out as a phlebotomist, a youth outreach coordinator, and then a year later, I was promoted to program coordinator. So I dealt with people, did outreach to people as far as on the streets, people that were in bars, women of childbearing age, which is anywhere from 12 to 45. I dealt with the public, basically, college students, middle school students, because they're, are at risk and they're at childbearing age, 12, and engage in risky behavior. Most of your transmission of diseases are between the hours of 2 and 7 p.m., because that's when kids get out of school and their parents aren't at home yet. So, party at my house. Woo. And girls seem to think that um, they're still virgins if they have anal sex or oral sex. No, you're not a virgin, and also you put yourself at a risk for any type of infection. So,
Now, if as far as to your knowledge, do you know that if they came up with a cure for it?
um, well, I mean, every time you mention HIV or AIDS is acquired immunodeficiency syndrome. That is when the T cell counts get below a certain percentage, below 12, and your body is open to opportunistic infections, anything like a cold, a flu, um, cancer, any type of infection, urinary tract infection, anything can break your body down, and most people would give up at that point, especially if they don't have the means to take care of themselves as far as medically, insurance and programs. Now, as far as a cure, I know that it can be managed if you continue to practice safe behaviors. It can be managed as far as medication. It can be managed as far as getting your T cell check counted every month. Get a primary doctor that specializes in HIV/AIDS research or studies and medical, as far as taking care of the person and helping them, as far as social services, because a lot of times you go into a depression, and that's what any STD. It's not just, HIV and AIDS, but, syphilis, in case you guys don't know. Once you contract syphilis, you're treated, but it doesn't go away. It marks your, actually, your blood cell. It marks it. So it will show every time you take a syphilis test if you're active or inactive, but you will always carry syphilis. So, other STDs, like, some you can get rid of, some you can't.
So there's like no absolute, unless you did what Magic Johnson did.
Well, they claim that Magic Johnson says that he doesn't have it anymore, and we always associate him when we mention AIDS. Is because, look at the dude. He's balling out of control. He got pretty teeth. He wearing nice clothes. He fly all the time. He on TV. He got a good job. He's supposed to have this AIDS virus, but now he's saying that he's cured. Supposedly, he went and had his blood filtered. So, I think that it's based on community, your community that you come from, and money. Whether you can get the proper treatment, better dollars, less treatment, less dollars. So that's just my personal opinion about it. Since I, have been out there working with, in the field doing outreach, working with LA County and other cities.
Now, do you know anybody that has the HIV or AIDS virus?
Yes, I've lost 3 of my friends. They were all female, and we were friends for a very long time, and they died back to back, and it was due to high-risk behavior as far as injection drug use. They were heroin addicts back in the day, and amongst them sharing needles with people that weren't bleaching their needles or getting new needles, and they died. And it's been about 10 or so years since they passed away. And I remember the first person that I had to tell that they tested positive was a 16-year-old African American male who was having sex because he was homeless, and he was having sex with older men for money and for food and shelter. So his whereabouts, I don't know, but I've seen people, success stories. A couple of people work in banks. They have jobs. They still remember me as the HIV lady from the mobile truck. And some of them, some people I still see that are still going strong. And there are some other ones that have already passed on.
Well. Thank you, my dear mother, for sharing your knowledge about HIV and the AIDS virus. I will see you guys in class. So, as we say, deuces.
Peace.
Bye. No, we say deuces.
Pieces.
Okay.
I mean, peace.